Cortisol. Everything you need to know and how to manage it. The stress hormone. Symptoms, risks and how to balance it naturally. Have you ever felt constantly stressed, tired, anxious, or struggled with weight gain despite your best efforts? The answer may involve a hormone called cortisol. In this video, you'll learn what cortisol is, why your body needs it, what happens when levels become too high or too low, common symptoms, and evidence-based ways to keep cortisol in a healthy range. Let's get started. What is cortisol? Cortisol is often called the stress hormone, but it's much more than that. It's produced by the adrenal glands, which sit on top of your kidneys. Cortisol helps regulate many important functions, including blood sugar levels, blood pressure, metabolism, inflammation, sleep-wake cycles, immune system function, the body's response to stress. Cortisol follows a natural daily rhythm. Levels are usually highest in the morning to help you wake up and gradually decrease throughout the day. In healthy amounts, cortisol is essential for survival. Why does cortisol increase? Cortisol rises whenever your body perceives stress. This stress can be physical or emotional, including work pressure, financial stress, poor sleep, illness, injury, surgery, intense exercise, chronic anxiety. When a stressful situation occurs, the brain activates the fight or flight response, causing the adrenal glands to release cortisol. This short-term increase is normal and can actually help protect you. Problems arise when cortisol remains elevated for long periods. Symptoms of high cortisol. Chronically high cortisol can affect nearly every system in the body. Common symptoms include weight gain, especially around the abdomen, increased appetite and cravings, difficulty sleeping, anxiety or irritability, fatigue, high blood pressure, frequent headaches, muscle weakness, difficulty concentrating, mood changes. In severe cases, extremely high cortisol levels may indicate a condition known as Cushing syndrome. Symptoms may include rounded face, fat accumulation around the neck and shoulders, thin arms and legs, easy bruising, purple stretch marks, high blood sugar. Symptoms of low cortisol. Low cortisol can also be dangerous. Symptoms may include extreme fatigue, dizziness, low blood pressure, weight loss, nausea, muscle weakness, salt cravings. One cause of low cortisol is Addison's disease, where the adrenal glands do not produce enough hormones. How is cortisol tested? Doctors can measure cortisol using blood tests, saliva tests, urine tests. Because cortisol naturally changes throughout the day, testing may be performed at specific times to obtain accurate results. Healthcare providers may also order additional hormone tests or imaging studies depending on the suspected cause. How to lower high cortisol naturally. 1. Prioritize sleep. Poor sleep is one of the biggest drivers of elevated cortisol. Aim for 7 to 9 hours of sleep. Consistent bedtimes. Reduced screen time before bed. 2. Exercise regularly. Moderate exercise can help regulate cortisol levels. Examples include walking, cycling, swimming, strength training. However, excessive high-intensity exercise may temporarily raise cortisol. 3. Manage stress. Effective stress management techniques include meditation, deep breathing, yoga, mindfulness, spending time in nature. Even 10 to 15 minutes daily can make a difference. 4. Eat a balanced diet. Focus on fruits and vegetables, whole grains, lean proteins, healthy fats. Try to limit excess sugar, highly processed foods, excessive caffeine. 5. Stay connected. Positive social relationships can help reduce stress and support emotional well-being. Talking with friends, family, or a mental health professional may help lower stress-related cortisol elevations. Medical treatment for high cortisol. Treatment depends on the cause. If high cortisol is caused by medication use, a healthcare provider may adjust the treatment plan. If a medical condition is responsible, treatment may involve medication, surgery, radiation therapy, treatment of underlying hormonal disorders. Never stop prescribed steroid medications without medical supervision. When should you see a doctor? Consult a healthcare professional if you experience persistent fatigue, unexplained weight changes, high blood pressure, severe mood changes, ongoing sleep problems, symptoms suggestive of hormonal disorders. Early diagnosis can help prevent complications. Conclusion: cortisol is an essential hormone that helps your body respond to stress and maintain important functions. While temporary increases are normal, chronically high or low cortisol levels can affect your health. Good sleep, regular exercise, stress management, and a healthy diet can help support normal cortisol balance. If symptoms are severe or persistent, seek medical evaluation. If you found this video helpful, don't forget to like, subscribe, and share it with others who want to better understand their health. Thanks for watching, and see you in the next video.